legislation that I'm working on and that three groups that are devoted to single payer are working on here in Minnesota is called the Minnesota Health Act, and it will create a program called the Minnesota Health Program. The bill's chief author is Senator John Marty in the Senate and Representative David Bly in the House. The bill numbers are Senate File 118 and House File 135. And what got me here tonight was Steve and I were talking about the fact that the House bill is coming up for a hearing on February 25. Now the Senate companion, Senate File 118, has already passed two committees. It got passed the Senate Health Committee about 3 weeks ago, and 2 days ago it passed out of the Senate Commerce and Consumer Protection Committee, and by fairly sizable votes. This is the first time in almost, 17 years or so, that we've had a hearing on the single-payer bill in the House. We've had single-payer legislation introduced in both houses since 1991, and this is the first time we've had a hearing in a House committee. We've had several hearings in the Senate. But let me just summarize very quickly what a single payer means. It means that one payer reimburses doctors and hospitals, and the one payer has the authority to set limits on what docs, hospitals, and drug companies can charge. The reason why you want a single payer instead of a multiple payer system is you save so much money on administrative costs. And the money, the administrative waste that we eliminate is both in the insurance sector and the provider sector. And that 20 cents is for things like marketing, advertising, telling doctors how to practice medicine, profit, underwriting, which means they will want to know your health history before they even decide to insure you. What am I missing? Lobbyists, insane salaries and perks for management. And so when you spend that kind of money on those kinds of things, you only have 80 cents left over on the dollar to pay to doctors and hospitals. That's the insurance industry waste, but these multiple insurers also force doctors and hospitals to incur very large bills just to get paid. So a typical 500-bed hospital in America will have 50 people in its billing department, whereas a typical hospital in Canada with 500 beds, where they have a single-payer system, will have 10 people in billing. To summarize, if you could get rid of all that excessive administrative waste alone in both the insurance sector and the provider sector, you'd knock about 15% off the entire healthcare bill. And to put that number in context, it would only take about 3% of what we're spending now to cover the 400,000 Minnesotans who don't have health insurance. So there's no other contender in the American healthcare reform debate that can make that claim. And our main competition is managed care. And I hope people have had it up to here with managed care as a solution to the healthcare crisis. The bill is coming up for a hearing in the House on February 25. David Bly, the representative from Northfield, is the chief author, and he will sit in a witness chair and present this bill to the committee. The committee has 20 members on it. Now, we don't know if 20 members will actually show up for the hearing, but the bill will not pass if it can't get a majority of whoever shows up for this hearing. And at this point, the people that we're working with who are in contact with the members of those committee are not sure that we have the votes to pass it. And again, this is a democratically controlled committee. And so I'm just driving that point home. Just because a committee is in Democratic hands does not mean that it's a done deal. So we're appealing to people all over Minnesota to contact your legislators, Democrats and Republicans, and urge them to support the Minnesota Health Act, which will set up the Minnesota Health Program. Let me just give you the names of some of the representatives on the House Health Committee that will be hearing this bill on February 25, about whom we're not sure. Some or all of these have not co-authored this bill, which is some indication at this point that they may not support it. Paul Thiessen from Richfield, South Minneapolis, he chairs the committee. You may have heard his name. He has announced that he is running for governor. Paul Gardner, Kim Norton, Patty Fritz, Julie Bunn, Diane Loeffler, and I think all the Republicans on that committee. Polls have shown for 15 years that 2/3 of Americans want a single-payer system. Now, if you stop the average person on the street and say, do you know what a single-payer is? About half will say, I have no clue what you're talking about. But if you ask them a simple question, and Associated Press Yahoo asked this question late in December of 2007. The question was, would you support universal health insurance under a system like Medicare, paid for by taxes and run by the government? So all the boogeyman words are in there, right? Taxes, government. 65% said yes. And the last piece of news is that's about the same proportion of doctors that now support. It's a little lower, it's more like 60% support a Medicare for all, single-payer system. I am convinced that we will never, if you ask me, Kip, why support a bill that is going to ruffle the feathers of a powerful industry like the insurance companies? And the answer is, I'm sorry, we can't get there any other way. We cannot get to universal health insurance at the price at which healthcare and health insurance is sold in this country today. This country sells healthcare at twice the rate per capita of other industrialized nations. And we do a horrendous job. We're leaving 50 million of our people uninsured, and all those other countries that are spending half what we're spending are doing it, and they're covering everything. So I'm urging people to contact all your legislators, but particularly if you have members on the House Health Committee. Thank you very much.
Kip, I wanted to ask you one question. One of the things that opponents to single-payer health care often say is, if we have a system like that, health care will be rationed. And I'm wondering if we maybe don't ration health care now.
A poll, I should have mentioned this poll, a poll that asked Canadians and Americans, did you not get health care that you needed last year? 25% of Americans said yes to that question. Only 6% of the Canadians said yes, or 4% of the Canadians said yes to that question. Rationing is far, far worse in this country than it is in other countries. And it's happening in largely two ways. One, lack of health insurance, or you have health insurance but the deductible is so high, or something isn't covered. And managed care. Managed care was invented to deny services to people. So, I mean, and there are other reasons why people don't get the care they need. But those are the two big ones.
For the relevant committee in the Senate.
The two most powerful people in the Senate are the guy who chairs the Health Policy Committee, which is Senator John Marty, who is our chief author. And then any bill that is related to health that costs money has to go through Senator Berglund's committee. It has to go through other committees as well. But those are the two guaranteed stops. Health policy, health money. And so Senator Marty and Senator Berglund are the two most influential senators in the Minnesota Senate because of the committees they chair. So to have both of them on this bill is helpful. John Marty, by the way, is a very articulate, persuasive author. I am thrilled to have him as an author.
One of the things that's always bothered me about the strategy used to press that particular issue forward in this country is that we get caught up in the minutiae of healthcare, the details of healthcare delivery, costs, etc., the logistics of it, etc., until it's so sliced and diced, until there's no comprehensive sense of us as a people having a progressive view towards healthcare. That the health of the nation is a commonwealth, that the whole nation as a whole deserves to be healthy. It's a right, a human right, not a commercial right. But as long as we have a system in which health is a commodity, only the wealthy will actually benefit from it.